Hi, I'm Dr. Brad Morris. I want to talk to you about pain and degeneration. One thing is we all are getting older, and as we get older, the joints are starting to wear out. We're born with a certain amount of cartilage, and that's all the cartilage we get, and it doesn't reproduce and it doesn't repair itself. So unfortunately, as our joints start to degenerate, we start having pain. And up until now, the best solution for this pain has been some cortisone shots or opiates, and we all know about the opiate epidemic going on now. Cortisone is one alternative that we have for these degenerated joints, and unfortunately they also cause degeneration. So while they're getting rid of the pain momentarily, they are causing more degeneration in the joint. So it's not a great alternative, but that's really all people have had to turn to. And when that stops working, then the next recommendation is surgery. And unfortunately, surgery is just not that successful. There's a long rehab associated with that, and it can be unsuccessful. So you go through all this pain and rehab, and in the end, you still have a pain in that knee. And the bad part about surgery is once you have a replacement in the shoulder, or the knee, or the hip, you can't undo it. So luckily, we've had the invent of regenerative medicine. And more importantly, the stem cells of regenerative medicine. Stem cells are our building blocks, and that's actually what made us when we were born. It's what formed our brain, our spine, all the bones in our body, all of our organs, the ligaments, the tendons, the nerves, and the cartilage. So it's these stem cells that are allowing us to heal. But as we age, the stem cells decrease in number, and they become more tired and weak, just like we do. But fortunately now, we have umbilical cord stem cells, and these stem cells are from a baby that's been born C-section. So a healthy baby is born, and then they take the umbilical cord. They take the umbilical cord through rigorous testing to make sure that there's nothing wrong with it, there's no diseases, and then they will freeze that until they send it out to us so that we can inject it. They freeze it so it stops the motility of those cells until they're ready to be used. We can then inject those stem cells into your joint, and those stem cells will actually start repairing you just like when you were a child. So these umbilical cord stem cells are much more powerful than ours. They replicate and they differentiate into new cell types. They don't have to have a blood type matching. These cells are immune system privileged. So they can become anything. They can become the cartilage, they can become the ligament, they can become the tendon, they can become the nerve, they can even regenerate organs. So they're a wonderful thing for pain. Here at Rejuvenate Health, we have studied these stem cells and regenerative medicine to come up with the best protocols for each individual. And so what we do is we'll do a complete history. We'll do an examination to make sure that it is only a degenerated joint. So many times people are getting these stem cells and they think that it's going to repair everything and everything's going to be good. But unfortunately, they still have that pain. And it's because there's more to it. There's more to just putting the stem cell into your knee and expecting that miracle. And believe me, I truly believe they're miraculous. But unfortunately, you have a degenerated joint. Well, what comes along with that is muscle weakness. We could have some nerve entrapment. We could have ligament involvement. The subcutaneous nerves could be involved. So it's really important to make sure that you have a detailed examination to find out exactly what is needed. And then once you get the stem cells, going through some rehab to make sure that these guys are going to do their job and you're going to get the best results. So Dr. Dekel and I have come up with what we call the DECMO protocol to get rid of these pains in these joints, whether it be a knee, a hip, an ankle, a shoulder, an elbow, a wrist. Stem cells do a wonderful job at regenerating these joints. It's safe, it's effective, it's literally done in an office visit. The amount of time that it takes to receive the stem cells is only about 5 minutes, and then those guys are going right to work rebuilding that cartilage. So I hope this finds you well. Dr. Brad Morris at Rejuvenate Health. Have a great day.